Hello, I'm Junkie Sakata. I am not a good English speaker, so forgive me for speaking in a machine voice. As a prelude to our discussion of the Bridge to Tomorrow theme, we have first considered the challenges facing life insurance companies today. The hot topic of the day is the threat posed by Corona. I would like to talk about the Corona situation in Japan and the efforts of life insurance companies up to today, as well as future efforts in response to the Corona for tomorrow. The number of Corona-positive cases in Japan is described. In Japan, the first case of infection was confirmed in Japan on January 16, 2020. The infection has repeatedly peaked up and down. The first wave peaked at 700 people. This peak is invisible compared to the most recent peak. Second wave peaked at 1,600 people. Third wave peaked at 8,000 people. The fourth wave peaked at 7,200 people. Fifth wave peaked at 26,000 people. Sixth wave peaked at 100,000. The seventh wave peaked at 250,000. The number of new positives increased by an unmatched amount compared to the first wave. How has this affected life insurance companies? From the beginning, Japanese life insurance companies have paid claims in the event of hospitalization or death due to coronas. However, the spread of the new coronavirus has put pressure on medical facilities and public health centers. In March 2020, the government introduced a deemed hospitalization policy that allows patients with mild symptoms or asymptomatic patients to be treated at home or in an accommodation facility, in order to concentrate treatment on those who are seriously ill. If the policy terms and conditions are followed literally, deemed hospitalization is not originally considered a reason for payment of hospitalization benefits. However, at the request of the financial authorities and the Life Insurance Association of Japan, life insurance companies announced in April 2020 that even deemed hospitalization would be eligible for payment of hospitalization benefits if a doctor's certificate or other documentation was provided. However, the number of infected people increased more than expected. This led to payment delays and a deterioration in the life insurance company's bottom line. Life insurance companies have taken a variety of measures, but have failed to achieve fundamental improvements. However, the number of seriously injured patients in Corona has decreased since the beginning, and in light of the change in government policy, the payment for deemed hospitalization has been revised. This has helped to curb some of the concerns about the worsening of administration and income expenses. The special response in Corona was necessary because of social needs, but it had a huge impact on the life insurance companies. What can we learn from this? For example, improving the efficiency of payment administration through data science and countermeasures against deteriorating income and expenditure in the event of a pandemic. In the past, assessments were generally conducted by accumulating know-how based on experience and referring to it. Advances in data science will make it possible to utilize AI to perform assessments. This is expected to reduce the burden on human resources. Actuarial skills would be useful when considering, for example, what items should be used in AI's underwriting decisions. What model should be used to determine the appropriateness of AI's underwriting decisions? One of the reasons for this problem may be that the value of the insurance benefit was not commensurate with the financial burden on the policyholder in the event of a benefit event. In other words, the adverse selection risk was too great. Initially, the company decided to pay benefits just for getting sick practically to an unknown virus called Corona, based on its social significance. But as the serious injury rate of Corona is decreasing, and if people can get several 100,000 yen for flu-like symptoms, it is not surprising that this kind of situation would occur. It is not surprising. In this case, the special measure of deemed hospitalization was implemented based on its social significance, but in the future, it will be necessary to consider whether there are better measures to take advantage of this event. For example, Are products designed in such a way that adverse selection risks are unlikely to occur? Is there a mechanism in place to ensure that the soundness of the life insurance company is not compromised in the event that adverse selection risk should arise? Reinsurance may be used to provide guarantees with high uncertainty of future payments, such as for infectious diseases. But, in the case of a pandemic such as the recent corona outbreak, the expected losses are large, and it is highly likely that reinsurers will have difficulty underwriting such losses. However, the process of gathering data from this event, creating a reliable model, and quantifying such risks is where actuaries can play an active role. Japanese life insurance companies have responded to the unprecedented situation of corona in accordance with their original significance. While there were many areas in which they were able to contribute to society, there were also many areas in which they could learn from. We actuaries should not ignore pandemics such as the one that occurred this time as something special, but rather should think deeply every day about how we can contribute to both the policyholders and the soundness of the company when similar situations arise in the future. We believe that this is what will lead to Bridge to Tomorrow.